So just as a brief follow-up from the last video, I think one of the other things that's important to mention and talk about in preparation for an appointment, something like this, is kind of support and having people around you that you can share your thoughts with and be able to talk things over with. That's something I'm very fortunate I've been able to do with my family, and they've been a great support. But obviously with patients with dental anxiety, sometimes the barrier to that can be the embarrassment, about the anxiety itself, because quite often people don't share that they have that phobia or fear. So then having a conversation with those closest to them is not easy. So I'm very fortunate in this, and I realise that how lucky I am, and the importance of having friends and family. I've had some really nice messages from people, and just being able to talk things over with family has been really important. Juliet, my wife, has been fantastic, just so supportive, even helped me set up my little station here. So this is with the preparation of my recuperation station, which is here. I've got to isolate, so after the procedure I've got to stay away from other people, just because of the risk if I caught a cold from somebody while healing. There's implications with the graft healing and things like that, so I've got to just stay out of the way of everybody for a couple of weeks. So I've got this little area up here. I've got work and things I'll get on with eventually, but to begin with I plan it on just chilling out. So I've gone old school here, and we've got some DVDs, a couple of books, some CDs to listen to, prepared some pain medication and things ready over there. So just being prepared is also important. And in the run up to any procedure, just understanding and having an expectation of what that's going to be like, and what the healing and recuperation is going to be like, is really important. So for dental patients, that's important. If you're maybe having a tooth removed, to just understand what that will be like and what the expectation is going to be like for that period. So getting all the information ahead of time is important, for what the likely outcome is going to be for that healing process, and how to recognise if there is an issue with that healing. So that's all information that I've had to arm myself with regards to how this will go. The hospital, I have to say, were fantastic with providing all that information, and that's part of the consent process. And obviously consent is really important, because they have to give me the risks, they have to tell me the things that might go wrong. Now, for somebody with an anxiety, the concern about that is if you focus in on the things that may go wrong, it's enough to dissuade you from going ahead with the procedure. So as I read through the consent form, and it's talking about the risk to the sense of smell, the risk to maybe losing sensation on the tip of your nose, you may be unhappy with the aesthetics of things afterwards, and it gives you the percentage risk for each of the things that you read. It'd be quite easy again to get drawn into those anxious thoughts, and drawn into that's what's going to happen to me. So yes, there is a risk, and there's a small percentage of people that sometimes things don't go exactly as planned. But again, you have to bear in mind that these numbers and these percentages are actually very, very small, and in fact, it goes back to what I said before. You've got your motivation and your reason for going ahead and wanting this procedure done, and the risks are there. As long as you're aware of them, if any of them happen, it's a simple case of just having to get on with it and manage it. So being anxious about those risks beforehand is just counterproductive. It's just going to make you feel worse in the run up to the actual procedure. So I'm aware of those risks. I know what they are. And if any of them happen, I will simply deal with it at the time. Worrying about it now, is that going to change my decision to go ahead with the procedure? No. Is it going to help me by going over them in my head? No. So are they useful thoughts to be hanging around in my head? Not really. So they may as well get out and let me focus on my recuperation station and things I can control. I can't control these risk factors, unless it's something like if you're a smoker and you've been told that the risks are higher if you smoke, you do have control over that side of things. So focusing on the stuff you can control with regards to any of this is important. again, educating yourself and understanding about the actual procedure and what it is that's going to happen is important, without getting too drawn into the minutiae or seeing or getting too much information. About a year ago, when I first decided I was going to go through this process, I did go onto YouTube and looked at septorhinoplasty video. I can still remember what that looked like. It is quite graphic. Do I need to look at that more than once to understand what it is that's going to happen? Absolutely not. Is it going to benefit me by watching it again? Absolutely not. What is it going to do? It is simply going to make me feel more anxious, more worried about it. So I understand exactly what it is they're going to do. I know what the risks are. I've got all the information I need, and I can focus now on my motivation for doing it, and I can focus on the stuff that I can control, the pain medications, the preparation of the recuperation. So these are the useful thoughts, these are the useful things that I can spend my time over these couple of days just getting ready. So I've got quite an interesting number of things ready here. So a couple of books, one of them, this book Breathe, I was halfway through reading, so I'll finish that one. I haven't started Captain Tom yet, so I'll look forward to being able to read that. Some of these videos are videos that I've seen before and they're favourite films. Some of them are things that I've never seen before and just have never had the time to watch, so we'll get into them. Lots of different CDs here, ranging from, of course, Iron Maiden to classical music, Frank Sinatra, Rat Pack, all that kind of stuff. Just depending on what I feel like at the time. I don't know. I won't listen to all these. I won't watch all these, but nice to have some options as I'm sitting here and just trying to recover and heal. So that's again, it was meant to be just a small add-on, but it's I think these are important points, talking about having people supporting you and talking a little bit about like how to get your head around risk factors, how to have an understanding of the process of the procedure without actually being getting too into it or too involved or overly concerning. That's not my job. That's the job of the anaesthetist and the surgeon, the ENT surgeon. That's what they're trained for. That's what they're doing. It's not my job. My job is to have the procedure done and then to heal. So that's what I'm going to do. All right. I'll speak to you again. Bye.